If you have a rabbit, knowing when something's wrong can make all the difference. Today we're bringing together the most important warning signs that your rabbit might be sick, so pay close attention to every detail. First, let's check out these 10 signs your rabbit might be sick. Some are so subtle, you might miss them. How to know if a rabbit is sick. At the moment a rabbit presents any disease, the guardian will likely know immediately. They are a sensitive animal and even small issues can affect their entire routine. On occasions when the animal is already showing marked signs and symptoms, it means the disease could be very advanced. Here are some of the signs and symptoms of a sick rabbit. Loss of appetite. When a rabbit loses interest in food, we should be concerned. It may be temporary, but if this condition is still present after a couple of days, the prognosis is negative. It is usually associated with digestive system problems, but any pathology can generate a level of stress in the rabbit capable of making them lose their appetite. Diarrhea. This can appear for a variety of reasons, generally bacterial or parasitic. It is associated with digestive pathologies, and if the cause is not diagnosed in time, it can be fatal. Weight loss. This condition is quite dangerous in rabbits and can be associated with almost any pathology. The guardian must be vigilant that their bunny is always eating correctly and maintains a healthy weight. Difficulty eating. Unlike inappetence, this sign means the animal looks for food but has evident difficulty chewing or swallowing. This sign is often associated with problems in the oral cavity, a common issue being abnormal growth of their teeth. Find out everything about feeding rabbits in the info video we share on the card above. Irritated or red eyes. Rabbits that don't receive proper handling from their caretaker or those that have significant issues in their environmental conditions can develop eye diseases such as conjunctivitis. Conjunctivitis is frequent in poorly managed rabbits, and red eyes are a characteristic sign of this disease. Ataxia. This refers to the decreased ability to control movement. It's associated with nervous problems, although it is also relatively frequent in vestibular syndrome and internal otitis. Abnormal head tilt. It is a clear sign of otitis or vestibular syndrome. Tilting their head usually points to this diagnosis. Hair loss. Skin pathologies are also common in rabbits that receive poor handling. Alopecia is a clear sign that something is wrong, and veterinary attention should be sought as soon as possible. Coughs and sneezes. In rabbits, respiratory diseases are also usually disastrous and they require speedy treatment. Any respiratory signs require urgent veterinary attention. In the next info video, we share one of the most worrying rabbit symptoms, specifically breathing but not moving. Other signs. All the pathologies that afflict rabbits can cause a variety of signs and symptoms, some of which can be symptomatic of different conditions. The person in charge of making the definitive diagnosis is a veterinarian. At AnimalWised, we see regular visits to the vet as a vital element of basic care. Remember that preventive medicine will give your best friend a better quality of life. Next, a more serious case. 5 signs your rabbit could be nearing the end of their life. These are critical signs you cannot ignore. One of the most obvious symptoms is that the animal shows no interest in food and water. If your rabbit isn't eating their hay, this lack of appetite may be caused by different pathologies such as scabies, dental malformations, or the accumulation of hairballs in the stomach. Rabbits need to consume hay and hydrate properly to survive, so not doing these things is a potential sign they may be dying. Other signs to indicate a rabbit is about to die are inactivity and apathy, something which may also occur when they are under stress. When the behavioural change is radical and the rabbit does not want to get up at all, something serious is wrong. You should provide a secure and comfortable space away from noise and cold while you contact the vet. When a rabbit is close to death, their vital signs alter. You will likely be able to observe a shortness of breath or a lower temperature than usual. To pay attention to changes in a rabbit's vital signs, we need to know them first. Their body temperature is usually between 38 degrees Celsius and 40 degrees Celsius, which is 100.4 and 104 degrees Fahrenheit. Their heart rate oscillates between 180 and 250 beats per minute. The respiratory frequency is between 30 and 60 breaths per minute, and the capillary refill time is between 1 and 2 seconds. When one or several of these signs have changed, it's best to go to the veterinarian immediately. Any animal close to death shows evident behavioural changes, whether caused by the pain of a pathology or even simply by old age. Variable behaviours such as fear or aggression may be observed. Additionally, a rabbit will often release their bowels just before they die. At the time of death, the rabbit's breathing is altered, thus initiating something known as the death rattle. The rabbit's breathing will become agitated and their pulse will lower. They may also develop stiffness in their jaw or experience some tremors, so if the rabbit reaches this stage, it's important to stay by their side. It's not easy to manage the delicate experience of a rabbit dying, however it's important to remain calm and help reassure the rabbit at a time when they may be anxious and apprehensive. Avoid loud noises, excessive manipulation and other stressors. Ideally, you want to act tactfully and softly, petting the animal to help them relax. If we feel uncomfortable, frightened or particularly upset, you should ask a trusted friend or family member to take over and accompany them during their last moments. The death of a rabbit is a very painful process, but it is also something natural. After death, you'll have more practical considerations in terms of what to do with your friend's body. You should go to the vet or a clinic to incinerate the body, but if you have the money and inclination, there are some animal funeral homes you can contact. You should never throw the body in the trash, as it can lead to diseases and parasites in the environment. You can also bury the animal somewhere special, as long as you have permission to do so. It's important to remember that when a pet dies, it's normal to go through a period of grief and mourning. It's healthy to express this grief and give yourself the necessary time to overcome the death of your pet. Sometimes, even the smallest details matter, such as a rabbit with one floppy ear indicating a health problem that needs attention. Otitis. The most common cause of a suddenly floppy ear in rabbits. This is an ear inflammation which can be due to bacterial infection, mites, trauma, or various other issues. Chope fibroma. This type of ear fibroma is caused by a virus that causes intradermal nodulations to develop. They usually first appear on the ears or the extremities. Ringworm. Ringworm also affects the hearing health of rabbits. This disease is caused by a fungus, especially those which present in a granulated variety. As it is a disease caused by fungi, different antifungal medications are used in its treatment. Discover other symptoms of a sick rabbit in the video that we share on the card above. Other causes. While it is possible a disease is the cause, we should not discount the possibility of physical trauma. A skin or muscle injury could result in a floppy ear. Since rabbits have extremely delicate ears that are comparatively large compared to most mammals, they can incur wounds or damage from a range of sources. Symptoms of a sick rabbit. When we see a floppy ear or other potential signs of illness in our rabbit, it's important not to ignore them. We should go to the veterinarian for a thorough checkup. To ensure we catch these symptoms in time, we must check on our rabbit regularly. Observe for signs such as apathy, lack of movement, poor coat condition, no energy for play, or a general lethargy and disengagement. Rabbits love to eat and will chew hay all day. If they seriously reduce their intake or stop eating altogether, it's a clear sign that something is wrong. Another way to tell whether a rabbit is ill is to look at their stools. If they have diarrhea, it's a likely sign of a gastrointestinal disorder. Not defecating at all is also a worrying symptom, especially since it can highlight a potential intestinal blockage. Other symptoms of illness in rabbits include respiratory distress, skin lesions, and eye redness. When a rabbit stops moving altogether, this means the animal may be suffering from a potentially fatal condition. Even if your rabbit seems fine, a bunny that is breathing but not moving might be in danger. It's vital to know these signs. Traumas, accidents, falls from great height, or attacks by other animals can make our rabbit stop moving. This is due to the impact of the trauma and possible internal damage. Bones can often be broken, and the animal experiences so much pain they can't move. If you suspect that your rabbit has been in a traumatic accident or received any injury, take them to a vet immediately. Old age. As the rabbit ages, their body will undergo certain levels of wear and tear. This can lead to problems such as osteoarthritis, as well as simply being less vital and energetic. Keep in mind that aging is progressive. If you see an older rabbit has changed their behaviour all of a sudden, something else may be causing their immobility, so we recommend you take them to the vet. Paralysis. Rabbits can suffer from paralysis for various reasons that explain why they breathe but don't move. Such paralysis can be prevented by ensuring their spine is supported, they avoid aggressive handling, have a balanced diet, and regular deworming at the vet. The paralysis types that affect rabbits are neurological, nutritional, and parasitic. Find out more about basic rabbit care in the video we share here. Stress. If you have observed your rabbit has also begun to show compulsive behaviours such as moving their ears or scratching, it may be due to stress. To prevent stress in rabbits, it's best to play with them and establish a strong bond based on respect for their rabbit behaviours. They will also need proper mental and physical stimulation. Avoid noise, don't scold, maintain a regular routine, and don't make sudden changes to their environment. Heat stroke. Extreme temperatures can increase the body temperature of our rabbits and cause heat stroke. Rabbits suffer when the ambient temperature exceeds 28 degrees Celsius or 82 degrees Fahrenheit. High ambient temperatures can make the rabbit remain stretched out, static, dehydrated, and lethargic. More serious symptoms include redness of the ears, hypersalivation, gasping, weakness, disorientation, tremors, seizures, and shock. Hypothermia. Although it is less frequent, rabbits can also suffer from low temperatures. This is why we should maintain an ideal room temperature of 21 to 27 degrees Celsius. Very cold temperatures cause hypothermia, resulting in physical damage if their body temperature falls between 36 degrees Celsius or 96.8 degrees Fahrenheit. In these cases, they will manifest signs such as reduced heart rate, disorientation, lethargy, dry skin, cold ears, and fainting. Appetite loss. Debilitating and painful internal diseases can present loss of appetite or anorexia as a clinical sign during their acute phase. This situation in rabbits causes weakness, depression, and low energy, leading to immobility. A multitude of problems and diseases can make your rabbit stop eating. In the video we share above, you can see when diseases progress whether your rabbit might be dying. If, in addition to immobility and loss of appetite, you see the rabbit shows other signs of disease such as weakness, weight loss, inflammation, lumps, diarrhea, respiratory distress, coughing, fever, or runny nose, it may indicate they are suffering a pathology. This requires diagnosis and treatment by a veterinarian. And remember, some practices that seem harmless, like trancing your rabbit, can be very dangerous. Here's why you should never do it.
Rabbits go into a trance thanks to something called tonic immobility. Immobility means the state of not being able to move, and we can know a lot more about it from the rabbit's action's alternative name, apparent death. This is because the animal seems as if it's indeed dead to the world. While it may appear that the bunny is unconscious, the truth is that the rabbit is actually in a state of increased stress. By turning the rabbit on its back and resting its chin against its body, the bunny goes into an automatic response. The reason for this response is fear. This state isn't just a defense mechanism, but also a fear response. Rabbits can also go into this state if they are made to perform a task which they do not enjoy, such as bathing. Many people want to put their rabbit into a trance for various reasons. There are those who simply want to have a laugh, often innocently thinking that there will be no effects of this phenomenon on the bunny. Some owners will have heard from sources telling them that laying the rabbit on their back like this will allow them to groom better. Well, this may be so if you are simply performing some cosmetic treatments to your bunny. The possibility of causing damage to them emotionally or even physically is not worth it. If you have a rescue rabbit or have a bunny which is the runt of the litter, often they can be prone to stress. Their little bunny hearts are made to pound too quickly and can possibly lead to heart failure. Inducing tonic immobility in your rabbit can send a weak rabbit over the edge. If your rabbit is used to being handled in such a way, it is possible that putting them in a trance will do little harm. However, it is not a risk you should be willing to take with a beloved pet. Some rabbits will enter a state of tonic immobility on their own. This could be as a response to a perceived attacker or even jumping awkwardly and contorting their body into the position which induces the trance. If this happens, do not panic. Simply scoop the little one up carefully and turn them over onto their front slowly. Be aware that the rabbit may be in a state of shock, so it could jump out of your arms in excitement. Keep them close to the ground and out of harm's way. Cuddle and soothe the rabbit as best you can and as long as you can. The exception to the rule is when trancing your rabbit is the lesser of two evils. Although rabbits can still feel pain, and we are not completely sure of how conscious it is during this tonic immobility state, administering anesthetic can also be dangerous. If you take your rabbit to the vet and they know what they are doing, then they may want to put them in a state of tonic immobility rather than anesthetizing them. This could be to administer an injection, check a particular health problem, or other medical issues. This is up to a trained vet and their discretion should be advised.
Caring for your rabbit is easier when you know the warning signs. Hit like if you learned something new, share the video with other rabbit lovers, and subscribe for more tips that might just save your bunny's life.